Hi, I'm Dr. Stephanie Kamalia Reznick. I'm an internal medicine physician and one of the doctors on call through Oscar. Today I'll be answering some questions regarding COVID-19, also known as the novel coronavirus. A lot of people have been asking, when do I know if I need to go to the hospital or not? And that's a really good question. To answer it, I first want to address a common misconception. A lot of people hear that 80% of infected people have a mild case and think that means a mild nagging cough or a case of the sniffles. Mild infections can actually feel pretty bad. You might have muscle aches, high fevers, a horrible cough, and not want to get out of bed, but it's still considered a mild case. Cases aren't considered severe unless you're hypoxic, meaning you don't have enough oxygen in your blood, or over half of your lung fields are affected by the virus. So when do you need to go to the hospital? Well, here's a list of some of the reasons you might want to call 911 or go to your local emergency room. First, if you feel severely short of breath, meaning you can't even say a sentence or two without huffing and puffing for air, or you can't walk a few feet to go to the bathroom without taking a break and catching your breath, that's severely short of breath, and you should go to the emergency room. If you notice you're coughing up blood, truly coughing up blood, not a few streaks of mucus, that normally means that your airways are dry and some nasal saline or a humidifier can be helpful. But if you're coughing up true blood, like a teaspoonful, that is a reason to go to the emergency room. If you have severe, persistent chest pain, unrelated to coughing, that's a reason to go to the emergency room. Coughing can cause some chest pain as it irritates the muscles in the chest wall. And that kind of pain normally doesn't need emergency care. But if you're having severe, persistent chest pain, regardless of whether or not you're coughing, that would be a reason to go to the emergency room. If you find that you faint, or you feel persistently very lightheaded, like you're going to pass out, that might mean that your blood pressure is low or that you need some extra fluid and would be a reason to go to the emergency room. If you notice that someone you love in your household who might be infected gets suddenly confused or is very difficult to awaken, so if you shake them or call their name, they're not getting up, that is definitely an emergency and you should call 911 for help. If you do end up getting emergency care, please call the emergency room ahead of time and let the ER know, or if you're calling 911, the 911 dispatcher, know that you might have the coronavirus. This allows the proper precautions to take place. If you don't feel like you're having an emergency, then please stay home, stay isolated. The CDC has a good website to explain all the steps you can take for isolation. And take the normal over-the-counter medications you normally would for a cough, cold, flu type of infection.